And now we start with theoretical part. To understand correctly how diaphragm works and which mechanisms are responsible for the penetration of air into our lungs, we have to understand the physiology of breathing. First of all, to provide inhale, we need to put some energy into it. To do the work, we need a muscle or muscles that can provide it for us. There is a lot of muscles that we call muscles involved in breathing. However, only one with the name diaphragm is considered as a muscle that provides physiological inhale. It has a shape of an arch, a dome, and while it constricts, it becomes flatter and general pressure in the chest decreases. That gives a possibility for the lungs to expand. Oppositely to the chest, the pressure in the abdomen area increases as the volume of it becomes smaller. To expand efficiently the lungs, the diaphragm needs to be very strong and trained, as it has to overcome the impedance of respiratory system. When we breathe quietly, the diaphragm becomes only one active muscle to provide the inhale. As we're making different kind of exercises, such as running, jogging, jumping, or in emotional stress, or in medical conditions that restrict the activity of diaphragm, like bronchial asthma, bronchitis, pneumonia, obesity, or even sitting job, we need to involve additional muscles to inhale to minimize hyperventilation due to the necessity of a bigger amount of oxygen to our skeletal muscles and internal organs. We call them additional respiratory muscles, and they are mainly intracostal, sternocleidomastoidus, abdominal, and some others. If we are healthy, the exhale is passive. However, in hyperventilation, we also involve additional muscles into it, like intracostal, abdominal, and even muscles of vocal cords. When the additional muscles are involved in breathing, the activity of diaphragm slowly decreases and it becomes more flatter with a less strong constriction. Flattering of a diaphragm with the loss of its muscular activity causes immediate decrease in the respiratory volume of the lungs and gradually leads to oxygen deficiency in our body. In this particular case, people develop so-called chest type of breathing, as upper parts of our lungs start to be involved in ventilation and oxygen supply. And the problem is, upper part of our lungs physiologically are having much lower activity of alveolar blood circulation and of course oxygen penetration into capillaries and then to our cells. Vice versa, the breathing by the main inhaling muscle, diaphragm, we call abdominal type of breathing. That involves only lower part of our lungs into the process of inhaling, where the activity of blood circulation around alveolus is much higher compared to the upper part of our lungs, and of course higher oxygen supply to our internal organs and muscles. If you look at our diaphragm that separates chest and abdomen part of our body from inside, you will see a lot of communication areas. First of all, the main artery of our body with the name aorta goes through it and brings oxygenated blood to all our internal organs and muscles. Very close to aorta is ductus thoracicus. It's situated just near, and it goes through the same window as aorta. As it goes through the aorta window of the diaphragm, it forms cisterna ilia, a reservoir of lymph from the lower extremities, right and left, internal organs of abdomen and pelvic area. Another big window is formed for the main vein of our body with the name interior vena cava that brings low in oxygen blood from pelvic and abdomen area and our extremities. By diaphragmatic breathing exercises, we intensify the flow of lymph and blood through our system. The diaphragm works as a pump to speed up the flow of lymph and blood, to oxygenate, speed up our metabolism and tissue regeneration, and also for better detoxification and immune control of our body. Another big window of our diaphragm is for the esophagus. It is very important to know where this window is situated, as it can play a role in appearance of secondary hiatus hernia. It happens with the sudden development of heartburn when our diaphragm is not trained enough and also has weakness in its ligament system. A part of incredible strong increase in flow of blood and lymph through the main vessels, the vital energy diaphragmatic breathing technique will provide the massage of liver, gallbladder, intestines, kidneys, and very importantly, adrenal glands. So no surprise you feel so lifted, happy, and rested after making these exercises. A part of stimulation of the activity of a diaphragm, these complex of breathing exercises are assisting in normalization of inhalation through the nose passages. To understand how inhalation through the nose works, we have to understand the anatomic and physiologic structure of the upper respiratory tract. Respiratory part of mucous membranes of our nose consist of one layer of specific epithelium covered with vibratory cilia or lashes that's supposed to move only in one direction, from the tip of our nose towards our throat. Why? It is because in between these epithelium cells, you can find another kind of cells, so-called goblet cells, as they have a shape of a wine glass. The main role of these cells is the production of mucus, with the Latin name mucin. When goblet cells are full of mucus, they break out and the mucus comes to the surface of the nasal epithelium, and the role of these mucus is very important. Everybody who is healthy produces approximately 100 milliliters of it in 24 hours. The main role of it is to protect nose epithelium from viral and bacterial invasion. Mucin by itself is very sticky and equally allocates through the nose epithelium. However, mucin has two layers. One is a surface layer, another is internal layer. The surface layer or protective layer is very concentrated and can stick any viruses, any bacterials, any pollen, and any pollution onto it, restricting their movement and penetration inside of the nasal epithelium. Internal surface of the mucous layer is oppositely very thin, and because of that can provide active movement of the mucus by cilia down to our throat. At the end, we can swallow the mucus or cough it out. Approximately the same structure of epithelium we have in our lungs passages, however, with opposite direction of cilia movement, from inside of our lungs towards our throat. And at the end again, you can cough the mucus out or swallow it. This process is called mucociliary clearance, and it is one of the most general and important mechanisms of the protection of our respiratory system from the pollution, pollen, bacteria, and any viruses, including COVID-19. The vital energy diaphragmatic breathing technique that you're going to learn today are definitely a strong prophylactic measure, especially in an epidemic viral situation, including COVID-19. These exercises being developed gradually with a lot of love and care, with the main idea to protect our body from respiratory infections, to control our metabolism and our blood pressure, to activate our muscles, and to bring up our emotional and intellectual strengths, and to reduce the aging process. Now, when the theoretical part is over, we're going to learn how to do the most efficient diaphragmatic breathing with the name Vital Energy Diaphragmatic Breathing Technique to support our health.